So, you have been diagnosed with diabetes. Now what? In this video, we will be answering a couple of questions that you might have, covering topics such as what is diabetes, what treatment options are available, and how can you live a happy, healthy life with your new condition. If you are watching this, you probably were recently told by your doctor that you have diabetes. A diagnosis like this can plague you with many questions, and you may be wondering, what even is diabetes? Diabetes is a chronic condition where the organ called the pancreas produces too little or no insulin at all, leading to increased levels of sugar in your blood. Many teenagers wonder why and how they got diabetes in the first place. There is a common misconception that diabetes only occurs in those living unhealthy lifestyle and eating lots of sugar. This statement may be partly true, just a little bit misinformed. There are two main types of diabetes. Diabetes type 1. The immune system mistakenly fights and destroys the insulin-producing cells in the pancreas, causing the pancreas to lose its ability to make insulin. This typically happens in the childhood or teenage years. If you're watching this and you are a teenager with diabetes, you probably have diabetes type 1. The other, probably more well-known type of diabetes is diabetes type 2. This is the lifestyle disease that typically appears later in life, but in this video we will be focusing on diabetes type 1. Before you were diagnosed, you probably experienced symptoms such as increased thirst, fatigue or severe tiredness, increased urination and bedwetting, hunger, mood changes, and just general irritability. Now, we've been mentioning insulin a lot. What exactly is insulin? Insulin is a hormone made by the pancreas that helps transport sugar from the blood into the body cell for energy production. So in diabetes type 1, your pancreas does not produce insulin, meaning that there is excess sugar in your blood, and this is what makes you sick.
So you might be wondering, how do I get better? Unfortunately, there is no cure for diabetes, but that doesn't mean you can't live a normal and healthy life. In order to achieve that, you will have to take your insulin when you have to, as well as make some lifestyle changes. Now let's talk about insulin therapy. So to start off, you get 3 types of insulin. The first type is short-acting, the second type is intermediate-acting, and the third type is biphasic. So these 3 types of insulin work in a very specific way, and we will go into more detail of when to use this, or if you will use this. There are 3 ways in which you can take your insulin. The first being a needle in a syringe, the second being an insulin pen, and the third being an insulin pump. Your doctor will decide which of the types of insulin will be best suited for you. Don't worry, taking your insulin is definitely not this scary, and we will go through the method now. Insulin should be injected into the fat layer just beneath the skin. So areas that contain a good amount of fat include the abdomen, the outer thighs, the upper arms, or the buttocks. So once you have decided where you want to inject, you have to gently clean the area with an alcohol swab and allow it to dry. So now you have to draw up the amount of insulin you need using a short, thin needle. Gently pinch the skin together and inject in a 90-degree angle. It is important to make sure that you don't inject into the muscle, but into the fat. Also remember to rotate your injection sites to avoid unwanted complications and scarring at the site. The storage of your insulin is also very important. The vials of insulin you are not using should be stored in a refrigerator. If you have taken out a vial to use, you can leave that at room temperature to use later. So now you know the types of insulin, the methods of injecting, how to inject, and where to store your insulin. But now let's talk a bit about how much do you actually inject. Firstly, The total number of insulin you should take a day is 0.6 units of insulin per 1 kilogram in body weight. This then gets divided throughout the day depending on which regime you are on. The first option or regime is the basal bolus regime. This regime works as follows. So you take short-acting insulin before every meal and intermediate insulin before you go to bed. The amount of short-acting insulin you administer is based on the amount of carbs you are going to eat, and the intermediate insulin before bed is about 40 to 50% of your total. Then secondly, there's the pre-mixed insulin. This insulin consists of short-acting and long-acting. So this is the biphasic insulin that we spoke about earlier.
Unfortunately, it can happen that you inject too much or too little insulin, and we will talk about how to handle this in the next couple of slides.
Let's talk about hypoglycemia. Hypoglycemia is the state of having too little glucose in your body. This happens if you inject too much insulin. Symptoms of hypoglycemia can range from looking pale, sweating, to fainting, or even having seizures. If you have mild symptoms of hypoglycemia, you can eat fast-acting carbohydrates, or drink juice, or a soft drink, or even milk to give your body more glucose. If you are having any of the moderate to severe symptoms, it is very important to get to the hospital immediately, as they will have to give a drip. Now let's talk about the opposite of hypoglycemia. Let's talk about hyperglycemia. Hyperglycemia is a state where your body has too much glucose or sugar. Symptoms of hyperglycemia include increased hunger or thirst, blurred vision, and feeling excessively tired. If you measure your blood glucose and see that it is higher than 10 millimole per liter, then you will have to inject more insulin. They recommend that you inject 10% of the initial dose you injected before the meal in order to combat the hyperglycemia. Blood glucose monitoring may be another phase that you are a bit confused about. So blood glucose monitoring is extremely important. You have to aim to keep your blood glucose between 6 and 10 millimoles per liter. You should try and take your blood glucose before a meal and 2 hours after meal to see if you fall into that range. If you notice that you constantly fall either below or above that range, it is important to tell your doctor, as they might have to adjust your insulin. That was quite a lot of information, and we hope that this helps you. If you have any questions, please feel free to ask your doctor at any time, and we really hope that this helps you in order to live a healthy and normal life with diabetes type 1.